Congratulations on your new baby. This video, brought to you by the Evergreen Healthcare Lactation Consultants, is designed to answer questions you may have about your baby getting enough when breastfeeding. Breastfeeding moms always want to know if their baby is getting enough. We are used to measuring and seeing, but with breastfeeding, we often have to learn baby's subtle cues. Generally, we can tell baby is getting enough just by watching them at the breast. Instead of watching the clock to note how many minutes your baby is nursing, try watching the type of sucking your baby is doing at the breast. After day 5, you should be able to hear swallows and see deep movements in the baby's jaw and throat, indicating swallowing. Note this baby has flutter-like, shallow sucks. While this is common at the beginning of the feeding, baby is not likely drinking much milk at this time. Once the milk starts to flow, you will notice this type of sucking. See the deep drops in baby's jaw? This is a good time to listen for swallows. In general, babies need to eat 8 to 14 times in 24 hours. This frequency will last many months. Some babies will need to eat very frequently to get what they need. When in doubt, it is always right to feed the baby again. Most babies will need to nurse on both breasts at each feeding to get enough. When baby is no longer swallowing frequently, you may find taking your baby off, changing the diaper, and offering the second side will become a nice routine. Newborn babies vary on how long it takes them to do a feeding. An average is about 10 to 20 minutes on each side. As they get older, they generally take less time to feed at each feeding session. Mothers often feel their breasts feel full of milk before the feeding and softer after the feeding. This is a good way to know baby got the milk from the breast. With time, the breasts adjust and the breast may no longer feel as full, even though milk is continuing to be made. Leaking milk isn't an indication of how much milk you have. Some mothers leak milk and others do not. Another good indicator of your baby's intake is their diapers. Baby should have 2 or more bowel movements in 24 hours. By day 5, baby should have 5 or more wet diapers in 24 hours. If your baby goes a day with no wet diapers or bowel movements in the early months, call your baby's doctor. It is not until babies are older, such as 3 months old, that they can go days without a bowel movement. It takes about 2 days to pass the black, sticky meconium, leading to green or brown, looser stools. By day 5, breastfed babies should have yellow, liquid stools. Parents often worry these liquid stools are a sign of diarrhea, but they are very normal. Seeing yellow stools in your baby's diaper is a confirmation that your milk supply has increased. It is normal for your baby to lose weight after birth. Up to 10% weight loss is considered within normal limits in the first few days of life. Your baby will be weighed at discharge from the hospital, at the postpartum care center appointment 2 to 3 days later, and again at the 7 to 10 day checkup with your baby's doctor, and every baby checkup thereafter. They should regain their birth weight by 2 weeks of age. If you have concerns about your baby's weight or breastfeeding, call your baby's doctor or the Evergreen Health Breastfeeding Center to schedule an appointment.